Hello, my name is Andrea Quicano, West Coast University student. This is my presentation for Epidemiology Nursing 306. The title of my presentation is Epidemiology of Sexually Transmitted Infections Among Individuals Who Have Been Arrested and After Incarceration. In this article, Epidemiology of Sexually Transmitted Infections Among Offenders Following Arrest or Incarceration, published by the American Journal of Public Health, the authors attempt to document and catalog the rates of sexually transmitted infections among individuals starting 1 year from when they had any interactions with the justice system, as well as identifying the risk factors associated with acquiring an STI. Findings from this study between the years 2003 and 2008 show interesting trends based on which area the data was gathered from. For example, according to the results in Marion County, Indiana, the amount of people who were placed in prison were unproportionately black and male. A common theme that they also found was that those who had already had a history of STI and a criminal record were the youngest of the group, with the average age of 23. In comparison, individuals who had just either only had a history of STI or history of incarceration, those individuals tended to be older, within the ages of 26 to 31 years old. Overall, this article has concepts of great importance and is an essential part in improving the health of not only these individuals who are in prison, but more importantly, it possesses a real threat to us, the ones in the community, when they are released from prison. STIs such as gonorrhea, HIV, and chlamydia are all potential hazards to our health and can spread if we are not cautious. Correctly identifying the risk factors associated with contracting STIs in individuals who have any relation with the justice system will not only benefit these inmates but also will help lessen the rates of STI in the future. The strength of this article was the fact that they use an important matter that affects society as a whole. Delinquency and unprotected sex within individuals who have a reckless behavior with the law can lead to other horrible things and blow out of proportion. Sexually transmitted infection is a very important topic, especially on individuals who have been incarcerated. However, on the other side, some of the study's limitation were, for example, the fact that they were not able to differentiate among infections acquired before, during, and after incarceration. Therefore, I feel we should implement even more restriction and perhaps test these individuals before they've been sent to jail. This way we have an idea about the person's health history, and this way we can prevent an epidemic that could be something treatable, and we can even prevent it from spreading. I believe the information that I learned from this article can be used in public health because it allows communities from being informed. During my nursing career, I feel like I have never been assigned a discussion in regards about epidemiology and how it really affects the community. This article clearly sends a message to individuals in how to take care of their body and what to expect when they are being sent to jail. This article can be a helpful tool in public health practice because we use important data from incarcerated individuals and the risk they run from becoming infected with a sexually transmitted infection. Why the scientists perform this study? Sexually transmitted infection is a sickness that is passed from one individual to another during sexual activity. In this article, we also learned that juveniles and adults entering correctional facilities have high rates of sexually transmitted diseases. For example, they can have chlamydia, gonorrhea, syphilis, and HIV diagnosis. So in order to have a better understanding about this matter, scientists performed this study to estimate the rates of different sexual transmitted infection diseases. Part of this study was also to identify the risk factors for test positive among individuals within 1 year after any interaction with the justice system. Some of the possible connections between the exposure and the disease is the fact that these individuals have a history of drug abuse and addiction. The use of substances such as heroin, methamphetamines have high rates of addiction. So when these young individuals or adult individuals suffer from substance withdrawals, they are more likely to do anything so they can get their hands on the drugs that they need. In the article, in fact, they state that these individuals in the post-incarceration period, meaning after jail, after getting out of jail, they often engage in high-risk behaviors, including unprotected sexual intercourse, concurrent sexual partnerships, and sex for money and drugs. During this study, the scientists conducted a retrospective cohort study on adults and juveniles with any interactions with the justice system in Marion County, Indiana. According to StacksDirect.com, this study looks backwards and examines exposure to suspect risk or protection factors in relation to an outcome that is established at the start of the study. In this case, they performed a retrospective cohort study of risk of having a positive STI like chlamydia, gonorrhea, syphilis, or incident positive HIV test in 1 year following arrest or incarceration. So in total, the amount of participants involved in this study was just over 247,000 participants. Also, the data that was gathered, the data was gathered between the years of 2000 to 2008. The reason why I chose this particular article to review was because of the importance of knowing how much of the population was affected with an STI. Many people think that because they are in prison and they have a disease, they won't affect the community. But in reality, I feel it does. I believe the article was very informative, very clear written, and very interesting to read. During the time I assisted to school, I have never been given the opportunity to really find out about studies related to epidemiology. So this time I found it very interesting to read about individuals with health issues while being in jail. Nowadays, I have the chance to practice my nursing skill at a hospital, and I think it's a wonderful thing, but I think it will be even a great opportunity to provide health to individuals that are actually in jail. This way, I can master my nursing skills. I have now finished my discussion. I appreciate the time that you have invested while learning all these types of STIs that can occur in the prison system. Thank you for watching once again.